You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Jennifer Jones Shults on signs your dog is aging. Welcome, Dr. Shults.
Thank you so much for having me, Polly.
I wanted to have you on the podcast to discuss aging pets. As all of us have had dogs for years, how do we know our pet is aging, and how do we know what to do?
Yeah, I have a full-time rehabilitation practice, and so probably at any given time, a third to a half of my patients are over 10, or what we would call senior or geriatric. And so this is certainly something that we deal with our clients a lot. Sometimes we're a little bit in denial that our pets are getting older, especially if you had them since they were a puppy. But probably the most common thing I hear owners saying is she's just slowing down, and sort of accepting that is just part of getting older, but it doesn't have to be. I think our medicine and our care for our pets and our dogs has gotten so much better that, I'm seeing Labradors have great quality of life, sometimes even to 15, 16 years old. And, 20 years ago, most people probably would have told you Labs only lived to 9 or 10.
Yeah, right. And do you think it also has to do with the food?
Absolutely. Better nutrition all the way around. We have some great companies that put a lot of effort into making the diets that are well studied, that prevent kidney disease and liver disease. And there's a lot of options there that can fit into different lifestyles, whether you want to cook your own food and have a custom recipe from a nutritionist, or, the simple bag that you can feed and trust that your dog is getting great nutrition every day. But absolutely, nutrition is part of it, better veterinary care, and our pets being more of our family is the other side of it too.
And when dogs start to age, how do their sleeping patterns change?
A lot of dogs don't sleep as well through the night. They get up and reposition either because they're uncomfortable, they can't hold their bladder as long during the night. Similarly, some dogs that have lost their hearing may sleep really solidly and not wake to every little thing around them either. So I think the most important thing is making sure that you're providing a bed, whether it's on your bed or, a bed on the floor for them that's comfortable for them to sleep in, making sure that we're doing that last trip outside to go to the potty right before bedtime, and, making sure that they're comfortable to help them sleep through the night.
How do you know if your dog is deaf?
The simplest thing is to wait until they're not looking at you. Come in a room behind them and clap loudly when they're not facing you. If they turn around with that sudden noise, then they can probably hear you. Usually it's more that owners sort of notice that gradually, that they don't come as much when they're called. They don't respond to that crinkle of the cookie bag or the UPS truck driving down the streat. But a lot of
universal.
Yeah. But a lot of times it seems to affect certain frequencies more than others initially.
And what type of medication should we start giving our dogs when they get older? Are there certain things that you would recommend?
Well, medications, as far as prescription medication, certainly you're going to want to talk to your veterinarian about what might be appropriate. There are certainly some diseases that are more common in our older dogs, low thyroid levels, that sort of thing, where your dog might be on a prescription medication. I think there are some supplements that can really help our older dogs, especially because of the diseases that are more common as they age. So one is high levels of omega-3 fatty acids. So omega-3 fatty acids are specifically anti-inflammatory. So when you think about arthritis or inflammatory bowel disease, omega-3s are great for that. Of course, I couldn't talk about supplements without saying that not every supplement is created equal and no one really monitors them. So you want to work with a company that's very reputable, does a lot of research to say what they say they put in there is actually in there, that it's bioavailable in our dogs, that it doesn't have any contaminants, and hopefully some clinical studies showing that it works. So my favorite omega-3 supplement is called Well-Actin Advanced. It's a really concentrated form of omega-3s, and it has an added active ingredient from green-lipped mussels called ETA. That's another anti-inflammatory.
And can you get that at the vet clinic, or do you go on Amazon, or where?
Usually both.
Okay.
A lot of veterinary practices try to make it easier for you to get things at the office. And certainly then you can trust that it was stored and shipped the right way. But a lot of these things are carried on Amazon too. The other one I really like for older dogs is an ingredient called fortitropin. It helps them maintain muscular mass. So similar to people, once dogs get their senior years, it becomes harder to build and maintain muscular mass. And if you combine that with maybe not being as active, they get weak and they can't support their trunk anymore. Maybe they can't go for long walks anymore. So fortitropin is in a supplement called Myos, which has a couple different versions, one with green-lipped mussel in it and another one with some branched-chain amino acids. But it really helps our older pets stay strong so that they can continue to be active. So I like that one too.
Yeah, we have a senior black lab, and I've noticed recently that she's having trouble standing up. Labs tend to follow you all over the place, the house.
Yeah.
And so when she tries to stand up, she's having some difficulty. So I should look into that for her.
Yeah, absolutely. And I think that because our dogs can't tell us what might be helping them slow down, it's where vet visits become more important, twice a year, to make sure that maybe she has hip pain. Hip dysplasia and hip arthritis is common in Labradors. We also see a lot of elbow pain or spinal problems. So I think it's important to get to the underlying cause of why your dog doesn't want to get up and move around as much, so we can be as specific in our treatment as possible.
Okay. And then what is dog dementia? Some of my friends have been talking about that their dog is waking up in the middle of the night and not sure where they are. And is that dog dementia?
No, so the term canine cognitive dysfunction was termed probably back 2004, 2005 was probably the first time we talked about it. I saw that out in the popular literature. And really it talks about, trying to compare these dogs to Alzheimer patients or people with dementia. And the process is a little bit different. It's not really the same process going on in the brain, but the signs of not knowing where you are, not being sure what you should do, maybe even to eat or drink, not recognizing the people that they recognized, getting stuck behind furniture are all things that we can see. And I think some of that we can see in older dogs. To be honest, most dogs with significant cognitive changes like that probably have a brain tumor. And we can't diagnose that without an MRI of the brain. And an MRI in dogs means general anesthesia. And so most of my owners with senior or geriatric dogs don't want their dog to undergo general anesthesia if it might not change what we're doing, because I can't say we do brain surgery a lot on senior dogs.
Okay.
But if your dog has those signs, then it is worth talking to your veterinarian about. There are some supplements, certainly omega-3s help with brain function. There are some Chinese herbal formulations that are directed at that. And then there are also some prescription medications that can help the brain function better. Sometimes we see seizures go along in those dogs. Onset of seizures in older patients can also go along with cognitive declines. And so if that's happening, certainly you want to talk to your veterinarian so we can get them on an appropriate medication.
Okay. And one thing that I've noticed is sometimes, we had a senior pug and he didn't eat as much as he used to. Is that pretty common too?
Yeah, absolutely. And, they're not burning as many calories. So some dogs, if they're not as active, so some dogs kind of self-regulate. Some dogs, we see more issues with digesting foods that might be rich or fatty as you get older. So some dogs need a diet more for a sensitive stomach that's a little bit more highly digestible. And some dogs just don't want to eat. And as long as they're eating enough calories to maintain their body weight, that's good. I think, especially if they're not eating very much, the composition of their food, right? Making sure that they're eating enough protein is really important.
Okay. Yep. Our family fosters senior dogs. We love senior dogs. They're so great. Well, thanks for being on the podcast. And I certainly appreciate all the tips on signs your dog is aging.
Yeah, absolutely.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.